I'm Dr. Michael Lardon. I've been a psychiatrist in clinical practice for 30 years. I'm a professor at UCSD School of Medicine, and I've had a special focus in sports. I've worked with the Olympics, the PGA Tour, the UFC, Major League Baseball, NFL football for many, many years, and my other specialty is psychopharmacology. And that's some specialized training I had after my residency, and it really looks at the subtleties of brain chemistry and how we balance those. Well, the concept of mental illness is not so discrete, like I have cancer or I don't have cancer, because we all have personality traits. Some of us have a little OCD and a little bit of obsessive compulsive traits. If you're an accountant, is an adaptive thing. But if you have to wash your hands 30 to 40 times a day and you damage the skin of your hands, then we have something that goes into the realm of mental illness. Anxiety. If you have a little bit of anxiety and you're going to do a TV interview or a book interview, that's normal. But if your anxiety is paralytic and you can't leave your house and you develop agoraphobia, then we put it in the realm of mental illness. So we all have personality traits, and when we're under stress, some of our vulnerabilities, they exacerbate, and things that before were not so bad now become an obstacle in our life. Well, I wouldn't say mental illness is an epidemic. I would say that mental illness has probably been constant from the beginning of time. It's just the recognition of mental illness is something now that we really understand at a much more sophisticated level. You can't argue with the biology of brain misbalance. If someone has a bipolar mood disorder, we know the circuits involved, we know how that works, and before, when you had something wrong, it was a character assault. But nowadays, even in some of the research settings, we have protein markers that show us anxiety, show us stress, show us depression. So we're kind of coming out of the dark ages, and really it's a more sophisticated understanding of brain chemistry and how that affects mood and how it affects anxiety and function in life. 30 years ago, I was probably the first psychiatrist who traveled with the PGA Tour, and everybody back then would never use that taboo word, a psychiatrist, because that meant you were given pills and you were on medicine and something was wrong. Now, fast forward 30 years, most of the top players have either a psychologist or a psychiatrist help them. And we've come to know that great athletes, lawyers, doctors, anybody can have an anxiety disorder. It's so ubiquitous that 1 in 3 people suffer from one of these things at some point in their life. I always say to folks, if it's not you, it's your brother, your girlfriend, your aunt, your uncle. Somebody has it, it's close to us, and it's something that's treatable. Well, when Aileen first presented to the hospital, she was psychotic. And she had taken some drugs, like many college students do, and she had some delusions. She was thinking things that plain were not true, and she had a tremendous, what we call, distortion of reality, and that's what psychosis is. Everybody, we say, is a little bit neurotic, meaning absolute reality is over here, and everybody biases reality based on their own experience, but when that bias comes to be so great that things really are not true, that's called a delusion. So if I think the FBI is following me and there would be no reason for that to happen, that would be a common delusion, and that can happen in psychotic states, which can happen from drugs, sometimes even alcohol, and then some certain mental illnesses, like a bipolar mood disorder, if you're in what we call a psychotic phase, or the mental illness schizophrenia. Well, I think of Aileen very fondly because I've known Aileen all these years and I've seen her struggles. And it's very disorienting as a young person to have a psychotic break and to wonder, am I crazy or am I not crazy? And then to be able to integrate that into your life, stay healthy, and still be productive. So here we are all these years later, and Aileen, has a beautiful family. She works, she's productive, she's writing this wonderful book to help folks. So it is a testament to somebody really achieving something great And I don't want to say in spite of it, because without, in Aileen's case, it's a bipolar mood disorder, but without that juxtapositions of mood, we don't have creativity and much of the intelligence of people that do great in life. So we can say if you have a little bit of the genes, that's quite good. If you have a little too much, we might go into the realm of mental illness, but also we cross into creativity and intelligence. So those things often go hand in hand. Well, I think I was well equipped in that I was quite a bit younger, and seeing a college student, being probably 10 years out of my training then, I really understood the culture of the day. The kids were doing ecstasy and mushrooms and all sorts of drugs in school, and they didn't really have knowledge as to what those things could do to them. So the first part was to use medicine to stabilize Aileen, to make the psychosis go away. So Aileen was normal as she is for the last 20 years. And then really it's about education and about helping her understand herself, that she's okay, that it's something, one, that she can manage, and she's done a great job doing it, and staying with her. And it's really been my honor to be able to help her all these years and to see her do well. So I battled with Aileen in the years, I mean that in a nice way, in terms of does she take medicine or not. And one of the things about a bipolar mood disorder is most of the time people are fine. And then they can have an episode where they get manic or they can get depressed. But when they're well, they want to not be on medicine, right? Why should I be on medicine? I'm doing well. But the type of illness a bipolar mood disorder is, it waxes and it wanes. It's episodic. And so when you take the medicines, you keep it in remission, which intuitively is hard for anybody to want to take medicines all the time, especially somebody in their 20s. So we worked through that issue, and then we had to work through her spirituality, her religion, and her commitment to Christianity, which, depending what churches you go to, you can hear people say, no, stay away from medicine, you just heal yourself with prayer. And if it was that easy, we would do it. And so to help her understand that it's not opposed, it's not mutually exclusive of understanding a commitment in a relationship with God. And I like to always say, you know, God pointed you in the direction of people that can help you. This is part of God's plan, if you will. It's not something completely different. Well, from the get-go, I knew Aileen was very talented and very smart. I mean, I saw what she was doing back then, what she could do. She has great capability and capacity. So for me, it was very fun. It was a little bit like treating some of the athletes I help, where you see somebody with great potential, and what do? We get their life in balance. We help them get it in balance. We help them learn how to manage their life with moderation. And my thought was, if she could get through those hurdles, we just let her go do her thing, and her talent in and of itself will speak for itself. A little like the athlete. You get the athlete in a good place, and then that athlete can go on to just achieve. You just let them go do it. Well, the initial challenge was getting the medicines right and getting her, you know, back feeling her normal self. The truth was, sometimes that's very difficult. With Aileen, it was very simple. We used a very light medicine, no side effects. She responded nicely. And we've basically been on that medicine, a little combination, for many years. So it's not always that easy. In her case, it was. So that was a pleasant surprise. Psychiatry is much more tricky this way. It's really a combination of art and science. So before I did psychiatry, I did internal medicine at UCLA. That's more straight ahead. If we culture a bug in your urine for a UTI, we know what antibiotic eradicates that pathogen, is what we call it. And so it's right there. But in psychiatry, it's a feel. We know the class of medicines, we know somewhat about what the receptors do, but it's still very embryonic, and it's not in a textbook. It's not a very straight-ahead algorithm. And that's why not all psychiatrists are the same, and that's why it's hard for a family doctor to prescribe these medicines, because Prozac isn't the same as Lexapro. There are a lot of subtle differences, And the name of the game in my profession, using medicine, is if I use medicines, I want you never to know you're on a medicine, like taking a vitamin. I just want you to wake up on the good side of the bed every morning. That's the objective. Well, we had a great outcome. Life still goes on, so we still work at it every day, one day at a time. I say it's never over until it's over. But you know, this is really what I hope for Aileen, and she's been able to work really hard. I mean, the doctor kind of points the person in the direction, and I can give some medicines, but it's Aileen that made the commitment to helping herself. So it's very fulfilling to see her doing well. I'd be lying if I didn't tell you the truth. I use Aileen as an example. I never mention her name, but as an example to many patients, especially young folks that develop symptoms in college or late in high school, and that's when many of these illnesses, they come about in the late teen, early 20s. And I'll use the example of here's somebody that went through something very similar. She took responsibility for it. She stepped up to the plate, and now she's been able to be this productive in her professional life and her personal life. And I think that's inspiring. It's one thing to hear it from a doctor. It's another thing to have an example set. Aileen's book does something I can't do, and that is that she tells a story from the first person. This is her story. So the ability for her to tell the experience is something that's so visceral to people, it's very important. I can be a doctor and I can talk about it, but I can't relate something that I didn't have myself. So I think in a way it's a synergy. One of Aileen's goals is to destigmatize this, which of course I applaud, and it's one of my life's passions. But I think if you couple the experience of Aileen with some of the knowledge, scientific knowledge, and the way we do it in the profession, I think that'll speak to people, and it'll help destigmatize and help people get treatment. In the younger portion of my career, when I was an internist, if you broke your leg, we would take an x-ray of your leg. We would show you that your leg, your femur was broken. There would be no equivocation. You would set your leg and fix your broken leg. Your apparatus of perception was your brain, and your brain was not impaired, it was your leg. So it was very clear. In mental illness, the apparatus of perception, your brain, is the one that's out of balance. So you can't see clearly what's going on. Your friends can say, hey, you're not acting right, or you're acting manic, or you're acting depressed. But it's very hard for you to really experience that because you don't know what your baseline is. You can't see yourself in an objective fashion because your brain chemistry is out of whack and it distorts your perception of yourself. It's very different from all the other medical illnesses we have, and it creates a great challenge. Here's the irony of that. So almost all medicines come from nature, where we look at the properties of things in nature, like anesthetics have come from curare that was shot by pygmies, and through there they developed a drug, succinylcholine. It's really a parallel. St. John's wort, okay, that has been used as a supplement for depression, is a very weak serotonin reuptake inhibitor. So we learn these mechanisms from nature, and then we, in the lab, try to duplicate them. For example, hypothyroidism is very common. 5% of the female population has it, and it's a very simple thing in that if your thyroid's low, you'll be tired, you'll put on weight, you won't feel well. Well, we can create the thyroid molecule fairly accurately. We call it synthroid, and we can replace it and bring your thyroid level to the normal 72 degrees, to use a metaphor, and then you feel better. That doesn't mean you're dependent on it, that you have a choice to take it or not. Similarly, if your serotonin is low, and I'm making it a little bit more simple than it is, but if your serotonin is low, you're going to be anxious, you're not going to feel good. The thermostat downregulated to 68 degrees, and what we try to do is use medicines to increase it just to a normal level. This is nothing like getting high from Vicodin or recreational drugs. This is trying to reinstate the homeostatic balance that we have as human beings. That's all we're trying to do. Keep it within nature's parameters. There is some truth that many psychiatrists do overprescribe meds. I always remark in my career after my residency, and I did a fellowship in psychopharmacology, I was consulted on lots of difficult cases. In the majority, I would wean down the meds. And I think a good dictum is if something doesn't add additional benefit, you pull back on it. But good psychiatrists don't do that. And it's like all professions in life. You have good doctors, not as good doctors, good lawyers, not as good lawyers, and you have to seek that person out. And that's why you do research and you make reviews, because if the psychiatrist has you on the wrong meds or too much meds, you might not know that. And we do see it, and people are on those meds for a long time, and maybe they're not the right ones or they're unnecessary, but not all do. There are many good doctors. That's why patients don't want to come back and see the doctor every month. You know, they like to take the antibiotics, get better, and see you next year. But you have to work with your doctor. If you have any side effect, that needs to be brought to the physician. And most of the time, I have probably several medicines that can make your symptoms go down. That's not the hard part. The tricky part is to ameliorate your symptoms, but you have no side effects. You feel like you're not on medicines. That's the true art to it. I do think that prayer is important, and meditation is important, and stillness is important, and belief and faith. These are very important things. But sometimes prayer doesn't make cancer go away. Sometimes prayer doesn't make the neurochemistry rebalance. And sometimes we pray for relief, and maybe it comes in the form of talking to a friend who says, hey, I met this doctor that was really able to help me. Because psychiatrists, we're not weird, strange people. We're just regular people that have an interest in mental health, like many of us do. And we combine our education and our professional experience to help folks. So seeing a psychiatrist, you know, although people have a phobia of it and they think it's some negative, I see it as a positive thing, as being courageous. You know, we have to take responsibility for what we have in our life. If we have a broken arm, we need to go get it fixed. If we're having anxiety that's affecting our life, we go see the doctor. And I do think that that's getting better as time ensues and our culture becomes more sophisticated. And it's books like Aileen's book that really help put this out in the forefront and destigmatize something that is so important and affects so many people.